So, after this very exciting step into the problems at the University Hospital Center, one of the biggest hospitals in Europe, in Serbia, we are back to Austria. I'm very pleased to introduce Hans Härting. Hans Härting is also cooperating with the Semmelweis Foundation since a couple of years, always to our pleasure. Hans, for those who don't know Hans, he's an airline captain on an A320. And within the Lufthansa group, he's responsible for training standards in the field of safety, security training, and management training of the crews. And since over 17 years, he runs in parallel to his job as a pilot and as a quality manager. He runs the company AssekuRisk. And together with his colleagues, he follows the idea of transferring this extremely well-developed quality system of the aviation industry to the healthcare industry, which is a very interesting thought. And the title of the lecture is Reducing Surgical Site Infections, 2 Successful Projects, 1 Short Report. Hans, please.
Yes, hello. I'm pleased to see you. I can't see my presentation right now. Just a thumbs up if you can hear me.
Yes. We can hear you. You're not muted, and the presentation was already there. And Monica is already working on the presentation. In a second, it should be here again. Thank you.
Okay. Yeah, I'm pleased to speak and take part, and I would like to give a short report about the projects we made, and we were able to reduce surgical site infections. And I would just like to explain how this is possible, or how we were able to do it. The very interesting thing is that also Professor Pité said that we need safe hospitals, and missing hygiene is primarily endangering everybody who's working there. And at the moment, we have 5 patients a minute. That's the actual data by the WHO on the planet. That's about 14 Airbus 380. A couple of years ago in the United States, this was the 3rd leading cause of death. So when we go to the history books of medicine in the early days, about 30, 40 years ago, medicine was primarily cheap, inefficient, relatively simple, but safe. There was one doctor for 2 days on a shift. He was fatigued, but he knew everything. And the system changed dramatically. Now we have situations like that. And when you see that, there's nothing else to say than this is bloody expensive. It is highly efficient. It is terribly complex, and it is very dangerous. Biljana was talking about, is it possible to work 8 hours without mistake? And me as an airline captain, I can promise you, no, it's not. But you have to establish a system which is able to contain those mistakes, that there is no damage following. And this is actually what we try to achieve and what we could do in medicine. When you take Formula One, for example, on this picture, you see 19 people working to get the tires exchanged within 1 minute and 20 seconds. And this is possible, but what do you need? And what does that have to do with medical personnel? This picture symbolizes a very, very high grade of standardization. And when I'm in the hospitals and I watch the teams working there, I do not see this standardization. We do have the standardization in logistic processes in the high reliability organizations. We have it in the atomic industry, we have it in aviation, we have it in space. Not every person working there must need or needs to look for a proper solution for a known problem. And we do not only have the missing standardization, we also have not real teamwork. Very often I accompany nurses on a round, and they are not able to articulate to the chief physician that he's missing out a relevant step. They are looking at him, they are glancing, they are hoping that he might raise his eyebrows, but they are not able to address it. So what we have is we do not have a hygiene problem in the hospitals. We have a problem with our behavior in that system. And how can you change behavior of anybody? Well, that's primarily what the challenge is. You need to work on the knowledge, on the skills, and primarily on the attitude. Safety is more a question of attitudes and values than it is of anything else. And when you want 19 people to change the tires of a car, you need to think about how do you do that. You need to train them very often, and then you have to coach them. And primarily, you have to get an atmosphere of psychological safety, that it's okay to make mistakes, that we are taking care of each other. And with that mindset, it is possible to fly airplanes every day. We transported about 4 billion people a year with a very, very low accident rate. Not because we are that well, but because it was possible to create a culture of mutual trust, of safety, and of cooperation. And that is the first step, and it missed out. In Germany, we have a law, that's the Krankenhauszukunftsgesetz, that is dedicating billions of euros to the digitization of healthcare. And when I go out there, I see problems which are totally different. There is a saying in aviation, if you think safety is expensive, try an accident. Professor Sachs from the University Hospital of Zurich said, if you think safety is expensive, try a pandemic. And we do not have glory in prevention. When we would have taken care about those things before the pandemic, wouldn't have needed to shut down the economy and catch up with the problems. So we are talking about the surgical site infection reduction. And on 2 projects, we had the trust that people said the high reliability principles must work in our organization, and we want to give it a try. And in those projects, we focused on team training and we focused on human factors. We said, we know that everybody's making a mistake every hour, and we don't care. We just plan it into our processes. We make it resilient. We make it possible that you make a mistake, and yes, you do not create an infection. So how did we do it? First, we trained everybody working in this hospital in the different mindsets we would need. The mindset that when a crew starts a flight, that you know you are performing as one team, that everything we do is about us, that we need a high cooperation between all professions and all departments. And we need to upscale non-technical skills. We need to address how do you articulate your concerns towards somebody else who is superior to you. By the way, these contents are not in a syllabus of university education or in a nursing school at the moment. This machine you see here is a mock-up of an A320. Just to let you know what is necessary to achieve a success, it is necessary behind the scenes to train every flight attendant and every pilot about 3% of the yearly working time in how to do work. They know everything, they have proven it, but they need to do it every year. And on those machines, we train the processes which should work to get this reliability. And we train for emergencies, and we train the routine operation. And when you look at this purple surface or square, this is about 100% of all reasons why processes in your system and in our system go wrong. And about 80% of the real reasons why it goes wrong, why people have infections, why they have surgical site infections, has nothing to do with hygiene, in fact. It has to do with poor communication. It has to do with missing coordination of teamwork. Everybody takes decisions every 10 minutes, but they are unstructured, they are not prioritized. We do not have adequate situation awareness. We only look for our responsibility. We don't look about half a meter to the right if somebody else is making a mistake and we are letting him know. And we do not have appropriate leadership. And leadership does not mean who's the boss. Leadership means how do I talk to my physician who is superior to me when he's doing something which is endangering safety. And if you do not have that training, you cannot possibly expect the knowledge and the change in behavior, what we need to get a success. This is the famous Moffat paper. And it was produced in 2015, and what that study says, we can send it to you if you're interested. As a test, what they did is they invested $3.6 million in a training program about the things I just explained to you. They trained everybody there, and they invested a lot of money calculating everything, missing time at work, more personnel needed, paying trainers who are accepted and qualified. But the return on investment in the United States was between $9 and $24 million. And this is something which actually also pays off. It does not only increase safety. Very famous baseball trainer said, in theory, there's no difference between theory and practice, but in practice there is. And this is the difference which is so damned important, because every quality manager, every chief of staff says, this is the work as it should be done, and this is how I expect it to be done. But it's not. Who of you waits 30 seconds before taking a blood sample to wait until the time is up, what the infectant needs to do its work? Nobody. I have watched hundreds of processes where somebody is putting something into the vein. These 30 seconds are not there. So we can further think about that's wrong. If it's not done, we have a problem. And when you go to your hospital, you take all your regulations you have concerning hygiene, and you see what do you think is being done and what is actually being done. When you compare those two values where your reliability is based on, you might find out that 80 to 90% is the assumption of compliance, and in reality it's 15 to 20%. And this is the gap, which is the problem. So what did we do? We had a hospital in Linz in Upper Austria, and we had a hospital in Zurich, and the university hospital, Department of Plastic Surgery. And on both locations, we applied the same principles. And we have two papers, they were published quite 1.5 years ago. And this was the project we did in Linz. They had a relatively high level of infections during Sectio Caesarea Sectios. And we went to the hospital, we took all the papers and said, how compliant are they with their own procedures? And we found exactly those numbers. What we then did after the training, we accompanied them every process we accompanied. We helped them to get the information across, to raise the awareness, and to speak up if something was missed out. And if they missed something and they addressed it, they corrected it beforehand. And the evidence-based cases was, how do you treat the temperature management of your patient? When is the antibiotic given before surgery? Are you making sure that he's getting the antibiotics? Is the temperature measured after, even before entering the hospital? Are the patients aware that they have to take a shower? Is it being stopped that you do shaving of patients but rather trimming? And is that compliance reason? That was the first success story. We had about 50% reduction of surgical site infections by that. And the second paper was the work in the University Hospital of Zurich. And we, as Austrians, we thought, Jesus, if you do a project in Switzerland, they are much more accurate than the Austrians. And plastic surgery, they are more accurate than any other profession. And we thought if we achieve a success there, we could achieve it anywhere. And also there we had a relevant success by reducing the surgical site infections by 1/2. And all theory and safety literature says you can only reduce the adverse events by 50% because the system is so complex. This is a checklist we used, and the checklist is not important. We found out during the project, and this might be important for you, that the checklists weren't even properly filled out and handled in only 60% of the checklists were really done well. And we thought, Jesus, this project will have no success because the checklists are not handled correctly. What actually happened is the awareness of everybody that those...
Excuse me, there is a voice in the back. Is that from
It's
you?
not mine. No.
Okay.
I think it's French language, Bernhard. I thought I only French.
But we have muted everybody else. It's somehow strange. Okay, let's continue.
No, I heard it, but I thought it's somebody else. I don't interfere.
No, everybody's muted. So, okay, thank you. Sorry.
No problem. But thank you for speaking up, Bernhard. It could have been background noise, but it's not. That's what safety is all about. And if you look at this checklist, the yellow steps, they are the ones which were relevant for the surgical site infection reductions, and the other ones were relevant for the patient safety in the changeover. So the yellow items mean, is the patient informed that he has to stop smoking? Did they do the proper hair removal? Was the patient, did he have a shower? Was the temperature managed? And those were all the regulations they needed in their hospital. They were there, but we had not real compliance. The next thing was antibiotics. The next item was the temperature, as I said. Then it was the allergy. We found out in projects that this surgical hand hygiene process didn't work properly. We had a weak spot on there. And what we did is we used nudging principles to raise the compliance with the surgical disinfection procedure. Not the hygiene department trained the doctors. The chief doctors themselves trained their doctors how to do it properly. So we had a real success, because when the chief doctor, the chief physician tells me how to do it, it's obviously something important. We also had iPads in the washing area. Everybody got a proper icon, a personal icon, where he had to push a button, and when the time was up, his personal melody was hearable in the whole surgical theater, inside and outside. We had a doctor, he's an Italian, and whenever he started his timer and he started his washing, once he was finished, in all the area you heard Bella Italia. So everybody knew he's here and his washing procedure is complete. And you can imagine he does not want to be at the patient when he hears Bella Italia. That's not what he wanted. So we raised the compliance in every process. And we also started to train medical teams on our flight simulator, which we invested to get one, because in a flight simulator, everybody has the chance to make errors and mistakes and to reflect about his own performance not in his own profession. That's very important. They are there as a team. They do mistakes, they do errors, they have something which is not working out properly. And then we discuss, how did they behave? Why didn't they talk about it? Why didn't they raise awareness? Why didn't they use the checklist which was there? Why didn't they take some notes to remember it? So in order to summarize it, if you want to have reliable processes, then you need to train the people, and primarily you need to train them about the different mindset, what teamwork is all about. And if you want some information, we can send it to you. It's all about leadership and teamwork, and that's what you could do and provide. But you need to have the proper trainers, otherwise they don't get through and they won't be accepted. Your medical motto means first do no harm, and we should rewrite that. We should not further call it first do no harm. We should call it first do all well. And if you think safety is expensive, don't try a pandemic. Thank you, Bernhard.
Thank you, Hans. Here is my applause.
Thank you very much.
Everybody that is listening. It's far above 200 people that are in the lectures permanently, which is a fantastic sign of trust to the content and to the speakers that we present in this little lecture. One short questions. Things that I've often heard, well, in the aviation industry, it is rather easy because it's one process to fly the airplane. And in the hospital, you have many different operation procedures. You have a variety of processes. You have more variations because you go into the specific patient, and so you cannot compare the two. What do you explain these people?
we are not talking about a safety problem in medicine. We are talking about a logistic problem. All the errors, also missing hygiene, has basically nothing to do with medicine. It's a logistical problem. And what people don't understand is that it's an all or nothing matter. When you fly with me to Rhodos for a summer vacation, I can do 99.9% okay. But if I do forget to extend the landing gear, we have an accident. I only missed out one step. When you do 99.9% of all hygiene-related procedures correct, but 0.1% not, you have got the transmission. And if this is not being understood, it won't work. People think, well, if I don't do everything, it's not quite perfect, but it's still okay. In hygiene, that doesn't work. And if you don't train and educate your people in that mindset, that it's an all or nothing, then it won't work. And we are talking logistics, not medicine, actually. That's what I would say.
Absolutely correct and convincing. When you try to transfer this way of thinking into hospitals, what are the biggest hurdles and the biggest barriers that you typically meet?
Hospitals don't have a training department because training in mindset is of no value. It's not being recognized as a solution at all. The biggest hurdle is the mindset of the responsible people for that organization. For example, last week I had a talk. They said we have a safety problem. We need to talk to the manager. Today I had a phone call. Yeah, it will be the end of April because earlier it's not possible. Is safety important? I don't know.
Yeah. In the middle of the Corona crisis.
Yes.
No further comments. Hans, thank you very much. We will meet each other again in the panel discussion at the end of the conference. Thank you so much. And for everybody else, now it is the time to grab a cup of coffee, to get some food, to find the toilet. We will be back exactly at 3 in the afternoon. And I hope that so far you have enjoyed the presentations, and we will continue then with reports from hospitals of different regions. Thank you very much. And